Welcome to CxXchange Success Hour Industry Series. Today's topic is health tech, which I'm super excited about. We'll be introducing folks in just a second, but I want to be sure. Oh no, where is it? Oh, wait a minute. Sorry, we usually have a slide for RevSetter. And RevSetter is what made all of this possible. This is our sponsor. Is there anybody from RevSetter here today? Can you speak up if you're here? Oh, and I just see we just let Adam in. We're just letting Adam in. Will, are you here?
Yeah, can you hear me?
Yeah, raise your hand so we see you, so you come to the front. Thank you. Will Hans here. He heads up, he's the VP of CS and sales, all go-to-market, which is the way really we should be set up, is have all of our go-to-market put together. But Will, raise your hand again. You went away. Okay, thank you.
I am right here.
Yeah. Can you just really quick, two sentences about RevSetter so that folks know what you're doing there? Because I love how you're bringing AI into things and just the whole PLG motion and everything.
Yeah, well, keeping it really quick, we're an AI-powered customer success platform built for everybody. So even if you're an independent contractor with a little book of business or need an enterprise solution at a large company, our motion goes from a free model all the way up to enterprise. So there should be something for everybody in customer success, but also, like Jan said, just really for all go-to-market teams. So we're really excited to be working with Jan, and we'll actually be a part of an event tomorrow with her as well, which is awesome. So just very excited to be, really in step with CxXchange and Jan as well.
Awesome. And Cynthia just added the RevSetter slide to the deck. So thank you very much.
There we go, Cynthia. Always on her game.
Yeah, thank you. All right, so let me get back to then introducing the topic at hand. We have health tech is the topic today. We do have an overview here, both in terms of commonalities as well as variables. But what I think we found is that while we have some things about health tech, is that you have people who have a passion for medicine and they're really there to help people, and they're not so much interested in tech, right? But and there's some other things too, but that otherwise it can be wildly different in terms of what the products are and things like that. So we're going to get into all of those things, but instead of focusing on the slides, I want to go ahead and introduce, I want to jump into the topics, and as we go through the topics, each person will introduce themselves. But and I know too that we do have some folks here who have experience in health tech. So please feel free to raise your hand and speak up as we go through these topics. But I think as we were discussing and we were preparing leading up to this session, we were talking about how it's really very different when you are in health tech, because it can literally have a life or death impact on people sometimes, right? And it's beyond just sort of a business viability. But then even when it is about business viability, it seems to have that added levity to it, right? And so maybe, Jen, do you maybe want to start us off, because you more recently moved into health tech, and what was sort of some of the striking contrasts for you as you moved into this area?
Yeah, it's been a pretty big learning curve. My name is Jen Williams. I am the VP of Client Success or Client Services for BBCS Inc., which is the blood bank computer systems. They do all of the software in the blood banks, a lot of the blood banks, not all of them. Obviously, Red Cross is a larger company there. But for me, transitioning into the health tech industry, there's a lot of regulations to learn and a lot of vocabulary and acronyms to learn, right? And so I think those were the two biggest things. And I'm still learning all of that. I think if you talk to people in the field, at least in the blood banking field, they're constantly learning, right? And so taking the time to research, taking the time to study up on the specific field you're in helps with that learning curve. And I did a lot of that in the first month. Yeah.
Yeah. What about the sense of urgency when you're in sort of the blood bank field? What kinds of things come up with that?
Yeah, it's life or death, right? If somebody gets the incorrect blood type or something went wrong with testing, it can be somebody's lives on the line, right? Or if they're needing to get blood shipped to a hospital quickly in order to save somebody's life and the software goes down, it's all hands on deck. And it seems to have a different sense of urgency. I came from the software or in the shipping and logistics industry prior to this. And their urgent was not being able to get a package out. Nobody's life depended on it. Or prior to that, I worked at Rackspace where urgency was maybe a website going down and people are losing a lot of revenue in their business. But this is truly somebody's life on the line. And so the level of urgency just, it astronomically goes up.
Lyndsey, maybe you can weigh in on that too.
Yeah. Hi, everybody. My name's Lyndsey Steinbock. It's great to be with you today. I started my career at Epic Medical Records, which is the electronic health record in use by the largest health systems and provider groups in the US. So if you have Epic MyChart on your phone, you're using Epic, but that's also what the providers are using to enter in all the important information about you. So at Epic, we had the concept of a patient safety escalation because if there was very regularly, unfortunately, there was an issue that could impact patient safety. And so identifying the level of prioritization and urgency of issues that come in and is very important in order to understand your response, make sure that you keep the trust of your customers, and then also get the support from your internal teams as needed when responding to an escalation. So PSE, patient safety escalation, became one of those acronyms in our industry that we all knew exactly what to do no matter what time of the day those came in, and they came in at all times of the day because this is an industry that doesn't stop. I'm not at Epic anymore, but I work for a company called Abridge, which is a clinician app, which allows them to record a conversation with their patient. And then AI generates a note draft for them to help do all their documentation for them. So it's a really cool product, but clinicians work 24/7. And it's an interesting thing to support clinicians and not work 24/7. I have 2 little kids and that would not work well for me. So I think it's just an interesting variable in our industry of how you support your partners, have very strong relationships and trust building, and also have boundaries and prioritization of issues as they come in.
So did you find then, like with the support versus customer success, that they bled over a lot, or just that in terms of customer success, that you had to be sure that escalations were being managed properly in support, or else it would impact your relationship with the customer and if they were achieving the business value they needed to?
Yeah, I think there is a lot of bleed over because the top issues rise up to become the things that executives need to talk about urgently. And a lot of times I'll get texted for them, or I'll have to text, my counterparts if I need a fast escalation on their side as well. So I think that, at least from my experience in health tech, that support and success do blend, and having clear differentiation of who does what team does what is important. But also, as a success leader, you need to be aware of what's going on the support side.
Interesting. Okay. Now, Shawn, admittedly, I didn't even realize that you were in health tech when we first started talking to, through all kinds of customer success things. I thought that you were more MarTech, even with the name Dr. Genius in your company title, right? And so tell me about that, because that's a very different angle on health tech. And yet you were like, no, I really belong over in health tech, Jan. What are you putting me over in MarTech for? So tell me a little bit about that.
Yes, and so I'd like to introduce myself to you. I'm Director of Success and Operations with Dr. Genius, and we serve the SMB market. Interestingly enough, we weren't totally in the health tech space maybe 7 or so years ago, and we've transitioned from integrating with third-party solutions into our platform to developing our own solutions and going live with those. So it's been a massive learning curve. And who we specifically serve on the SMB side tend to be more of what you would think of the mom and pop private healthcare practices and providers. And it's been a journey, but we certainly are in the health tech space. From what do we integrate on our website and how does that data pass through from PII, PHI, and other HIPAA compliance considerations to integrations into their EHR or PMS, and how does that integration occur, and what safeguards do we have? What are we doing with the data, if anything, and many other questions. So that's what we do, and we've been in health tech probably about 7 years now.
So would you say then that you end up with dealing with sort of life and death, or what's your relationship with your customers? What sort of, like, let's kind of get into some of the personas and, kind of what do you mean by B2B to P? Do you even really think about the patient so much? Where do you stand with all of that?
We think about the patient's not life or death, primarily due to the concentration of our client, which is in dentistry.
Mm-hmm.
Our challenge has to do with federal regulations as well as individual state board regulations, and those vary tremendously.
Regulation.
An example would be I will double check this, but there is a regulation with the Florida board if you're unable to provide emergency care, including dental. So if tech goes down, or if there's some issue with your tech that prevents care, you could lose your license. Or if there is a breach of some sort, even the slightest breach, and that does vary across individual states and their boards. But what we deal with has much more to do with the client and their business operations, and it's critical to their operations. It's less about patients' lives on the line. It's much more critical to their operations. And our challenge is the SMB side, or more so the smaller segment. They are looking to adopt tech as fast as possible with less of a concern on what is the damage if we do it wrong. They're just depending on us to understand that. Whereas an enterprise likely takes much more care and time to evaluate software. The SMB side is deploy it, and you just need to know how to get it right.
Mm-hmm. But you've actually had your CSMs learn all of the other types of products that these SMBs will be using, because in order to get them to success, they need to be able to help them navigate more than just your own tool, right? Like,
Correct.
Talk about sort of those personas and how that's impacted how you've trained your own teams and defined success.
Yes, that's a good point. I would say our CS individual needs to be well-rounded when it comes to understanding some of the pitfalls with third-party integrations and various PII, PHI, and other regulations. When it comes to third parties, too, our CS team has conferenced in third-party software systems to walk through certain steps, be it an integration or just retrieving some data, but ensuring that data is retrieved in a way that's secure and private, and we're not sharing too much information. And so our CS team has to be pretty well-rounded there to help support our clients, because if this third-party software that we may not be integrated with but has a great impact on our success with the client, that will absolutely affect our relationship. and success. So we need to make sure our team is able to work with our software, understand that, but also work with third-party software and understand broader business and regulatory implications.
Right. That's interesting that regulations come in even when we're talking about personas. It's a heavily regulated industry for sure.
Heavily.
So let's open it up and talk about those personas. What's different about the personas that you're working with in health tech? Lyndsey?
Sure. Well, I work a lot with clinicians, and one of the best things about being in health tech is I can help with clinicians without actually, and therefore help their patients without having to go to med school. So that was great for me because I didn't want to do the icky stuff, but I still wanted to help people. And so I think that's just a really cool thing about our industry in general. But working with clinicians, they are a group of people who are already overworked, already exhausted. After the pandemic, especially, there's a huge industry-wide problem of burnout and clinicians leaving the industry altogether. Many of them doing the tech space, but leaving practicing altogether because it's just too much and they're burning out and it's not a healthy environment. So when we are introducing a product to clinicians, it has to be with the clinician in mind. And these are folks who do not have time to attend trainings. And it has to be a product that is very intuitive and brings them immediate value, or else they're not going to use it a second time. So I find that really an interesting challenge and fun challenge. And it's something that myself and my team really hold sacred. We'll take the time, whatever time is needed, to perfect our training so that it can be completed in a shorter amount of time, or work with the product team to perfect our UI so that it is saving the clinician time, even if that's taking more on for us.
Interesting. And I know that there's other folks in health tech who are in the group, so feel free to add in your thoughts and come off mute as well. Was there anything else we should cover on personas, or should we dig into regulations a little bit? Oh, Sylvia, you can mute.
Yes, hi. I work in the medical imaging space. I'm the director of customer success for the largest radiology practice in the country. So we are from Hawaii to Alaska to the mainland, and we're in almost all states. Customer success is a new service lane in our practice. I came from, actually, I was in clinical. I was a radiology technologist for a number of years, transitioned over to the technical support. So supporting the PACS, which is the system that radiologists and clinicians use to view images now. Supporting any clinical application that was affiliated with medical imaging. And then the practice that I work for realized how critical customer success is. And so this new service lane actually drives the technical teams. So we are the ones that follow the customer through their journey. And we drive the other teams to be able to get the customer to a successful state. Our personas are clinicians, as Lyndsey mentioned. Patient care is ultimately our number one focus. So we always have the patient in mind when we're working with the customers. We do deal with life and death. Stroke patients and NICU babies are probably the two most critical parts of imaging that can save someone's life. It's not done within 15 minutes.
Oh, wow.
Yeah, so we have to make sure that our systems are stable. The images are going where they're supposed to be in order to get a diagnosis. So,
wow,
really exciting.
One of that reminded me, Sylvia, one of the things I wanted to talk about was how important in this space it is to have clinician champions and find the clinicians who really love technology to help drive some of the change management, because as much as we can learn about the industry, like I said, many of us didn't attend medical school. And so finding the folks that did and who love technology, who can kind of lead the way, will help make sure that every aspect of our job is successful. Help point out product improvements, expansion techniques. I mean, you name it. So that's just a huge takeaway, I think, for the group is find your champions and become best friends with them and listen to them and make sure that we use them to guide us.
Interesting. Jen, did you have anything you wanted to add in? Because you're in a very different part of the healthcare field in terms of regulations and personas and all of those things.
Yeah, the personas, I think for the blood banking industry, they're very passionate about the patient care, very passionate about quality over quantity or speed, right? And so for us specifically, the implementation time is hindered both by making sure we're taking time to fully implement everything from a quality perspective, double checking all of the data, as well as from a regulation perspective and trying to get approval from the FDA. So we're impacted by both of those. I would say that we don't see a lot of turnover. I don't see a lot of turnover in the blood banking industry so far. Our customers have been with us for decades in many cases. And people just are passionate about taking care of the customers regardless of what's going on around them. You know, they're there for the higher, I mean, they're there for a higher power, higher meaning, right? Is to help people, right? Than it is for instead of the smaller.
So, okay, so then what about contract length and things like that? When you're going through renewals, when you're thinking about strategically how to manage these accounts, you know, is everything, you know, long, you know, contracts? Are you working with companies for years upon years? Are you, can they, you know, switch in and out, you know, from one month to the next? Let's look at some of the variability around that.
So for us, it takes almost a year to implement the software. By the time you migrate,
a year to implement.
A year to implement. By the time you migrate the data, you do the training, you validate everything, make sure the FDA is involved and approved everything. It can take up to a year. And so for us,
so what about time to first value when you're implementing for a year?
It's hard, yeah. But you're in the software. The project team is in the software and seeing the value from the software right up front. They're just being able to use it until it's been approved by the FDA, right? So they can see it as we're building it and seeing where it will help them in the transition. And it's more excitement around driving that to finality, right? To implementation. And our contracts are all a minimum of 3 years because it takes so long to implement that customers, they really don't want to leave once they're there, you know?
Yeah. But Shawn, now you're on the other extreme. You've had to work to go from monthly to even annual, right?
Right. Yes, definitely on the other extreme. So 99% of our business was month to month. So that you're fighting fires a lot. You need to deliver a lot of value, and someone can leave you with a 30-day notice. We've transitioned to the majority of our agreements are now 1 year, and some of them are 12 months, but our integrations are not nearly as long. They're not as long at all. There may be a few weeks, so it's a little
much
different.
Simpler product. Much
simpler. A lot of our integrations are read only. We have some read write, and like that may take a little longer. So it's much faster. Our time to value needs to be fast. We still need to always deliver value over and over as fast as possible, even with a 12 installment or 12 month or 24 month agreement. The perceived pain of switching is still pretty low. The more tech you can get integrated and the more value you can deliver, the stickier the relationship. But still, with this persona, they can be hard at times to please over a long period of time.
Interesting. And so then there's also a question about customer education and training. So maybe you want to add in your thoughts on that. And Lyndsey, maybe you can share some of those thoughts.
Yeah, well, it's interesting because I, like Jen, when I was implementing Epic, that was year-long implementation generally, but it touched every single person in the health system, from a scheduler to the patient to a back-end billing and every clinician in between. And the education was a huge lift, and we would have entire health systems hire on training teams to do weeks-long training. But that was a huge impact to every single user's daily workflow. And now I'm in a smaller space at a bridge where we, again, integration is so key. Like Shawn said, if you want a product that sticks, you have to integrate with the other softwares that they're going to have forever. So the Epic softwares at health systems, they're going to have forever. If I want my new AI product to stick, it has to integrate into Epic, because clinicians don't want another app. They don't want to open another phone. I'm sorry, another website. They want to open their daily workflow and have everything right there. So I think integration is a huge piece of the healthcare persona in general.
Yeah, we're seeing that at the SMB level too. So it's not just at enterprise or groups. We're seeing it at the $2 million a year practice wants their application or dashboard to integrate with multiple other tools. And so it's certainly a shift in the buying behavior at that level that I'm noticing. It's happening pretty fast. Your tools just need to keep it short. They need to play nice with others, and they absolutely need to work with the big names.
And Jen, weren't you saying too that you do your training really as part of the implementation? Is that part of?
We sure do. We go on site. So we're really big on tailoring the experience and building like a white glove experience. So we'll go on site at the very beginning to do training with the implementation team, and then again on site at the end to help with training for their team, as well as be there for the launch of the platform.
Yeah. And Tyler, I see in the chat you mentioned something about sales cycles and how the variability of those and the length of those. Do you mind coming off mute and sharing what you were mentioning there?
Absolutely. Good evening, everyone. As we were talking about contracting, made me think about the sales cycle itself. And depending if it's health systems or health plans, the range of how long it takes a customer to sign can take a very long time. And part of that is related to security. If you have SOC 2 or high trust, the huge variability point there. And also, like everyone's mentioned on the call, clinician buy-in from the very beginning, depending on the tool, and executive buy-in as well. So there's a lot of variables, especially if you are segmenting customers based on systems or health systems or health plans.
Mm-hmm. Yeah. Sylvia, I see you're off mute. Did you have something you wanted to add in?
No, I was going to say some of the same things that Lyndsey and Jen said about the implementation time for our systems. It can be a year. We actually, for training, we are putting training under customer success, and we're leading that effort now. So we're building a training program for our customers, be that radiologists, technologists, whatever customer segment we're dealing with at the time. But training is so critical, and we put it in the onboarding process of the life cycle.
Yeah. Yeah. It sounds, I think we've kind of covered a lot of the things we talked about before the session, talked about some of the commonalities. I think one thing we haven't really mentioned is just how critical it is for CS to be voice of the customer. And Lyndsey, that got a really big nod from you. So maybe you want to bring up what you're thinking with that.
I just love working with the product team. It's like one of my favorite things. And I think, all of us here know how important it is as a CS partner with our customers to just listen and hear their what would help them. And then get to be creative with the product teams and making those needs a reality. And I think a lot of us love our jobs because we get to kind of solve the problem through technology and through relationships and working on change management, for example, right? A problem could be resolved through training, better training, and a better UI potentially, or one or the other. So it's so fun to just, make sure that we show that partnership with our customers by listening and then by reacting and say, here's what I've been hearing. Here's some ideas that we have on how to resolve it, and get that feedback. And I just smile because that's one of my favorite things I get to do on a daily basis.
Love that. Any other thoughts or questions before we go to breakout groups? Cynthia, your hand's up.
Yeah, I actually have a question about when I'm thinking about year-long implementations. I'm really curious, what's the biggest challenge there? Is it adoption after fact, the bureaucracy of regulation, or keeping the customer engaged throughout the implementation? Because I think a year is a really long time for people to start to lose focus, and then at the end to wait even longer for approval. I'm just super curious how that works.
Yeah, I can talk to that. So for me, the what's the hardest is keeping people moving, right? So a lot of what takes the longest is rewriting every single SOP or standard operating procedure that the blood banks are dealing with, right? Not only do they have to get that run through and approved internally, they have to also get that approved by any of their vendors or the hospitals that they're working with, right? And so that can take a lot of time to take the time to rewrite everything, retrain the staff, get everybody who they know that is engaging with that software, also trained up on the changes and how their processes are changing. That's really what takes the longest for us. And so the way we manage that is by truly understanding step by step, how many procedures are you have to rewrite, and then every week tracking progress towards that, and then starting earlier in the process than later, right? So we've tried to move everything as much as we can, move everything up in the implementation process that is going to take a long time to try to speed it up.
All right. Ramani, sorry.
Oh, go ahead.
Yes. Oh, Sylvia, sorry, you had a comment on that?
Yeah, I was going to say for radiology, it's the migration. Security is huge. I'm sure you've all heard of health system getting ransomware attacks. We have to make sure that we have an ample security in place, a lot of meetings with that and approvals and making sure that the product is going to be solid. A lot of testing. We go through rigorous regression testing and making sure that we mitigate the bugs before we go live, which takes after regression testing, then we have to do user acceptance testing and that process. The way we keep the customers engaged is we have periodic meetings with them to let them know where we are. Let them know if we came upon something that's, moving us back a little bit, but how we're going to, get back on track, and just keeping them engaged every step of the way and allowing them to ask questions helps with that long annual period of implementation.
And Shawn, I'm glad you put your hand up because it also made me think too about not just ransomware, but the legal issues that come up.
Yes. So 2 points. One is my wife is a supervisor at the lab at Hoag Hospital, and they went through an Epic integration. So I happen to, although I've never worked for Epic, happen to understand that was a very long integration. I think it was about a year, and SOPs were a huge talking point daily, weekly, and a frustrating part of the change management. So I know that was a long integration. When it comes to legality on what I do for work, I think maybe Jan, you're talking about some of the lawsuits levied against the under $25 million a year companies, and that could be a huge challenge when it comes to legalities, whether it's a true violation, perception of a violation, because you don't have resources to fight a charge against you, and that causes serious and severe business disruption for
Those
that
are
segment of
kind
businesses.
of frivolous and harassing sort of lawsuits that get
Oh,
filed,
100%.
right?
Yes, it's made it to the news, and now it's making it to Congress to have more clear legislation on certain guidelines, because in the absence of a black and white guideline, you have a lot of gray area that can be leveraged leveraged in a bad way to attack small businesses that you have a safe assumption that they don't have the resources to fight back, and so they settle out of court for large sums of money they don't really have, and it causes serious problems. And I believe it was 70 or 77% of digital lawsuits are levied against 25 million or less annual revenue companies. It's just because they can't afford to fight it. Large enterprises have a full legal counsel, and of course they can fight those things. But yeah, it's sad. That's what we deal with on our end of the spectrum.
Okay. Ramanya, your question, and then let's go to breakout.
Sounds good. Thank you. Yeah, my question is for Shawn. So I've spoken to health tech practitioners in CS, and I know that when we have a enterprise-like sort of structure with multiple levels, the buyer persona might be quite different depending on what's the software, maybe quite different than the clinicians and the front-end staff that would be utilizing it. So there can be that sort of challenge between CFO, I bought it to realize savings. However, if my front-end staff in clinics, hospitals, etc., is health systems is not utilizing it, I'm not realizing the savings. However, in Shawn's space, which is the SMB, would you say, Shawn, that at least you're spared that type of, convincing and multiple level demonstration of value? Like, would you say you always speak to the owners or business operators who purchase it and then they also use it?
I would say it's yes, and while you may be spared some of the more lengthy value proposition sales cycle or integration cycle, you're also met with needing to deliver value is signed as soon as the agreement is signed. And maybe that's true for all segments, but you're put under a lot of pressure. You tend to deal with the owner operator. Problems with that are they do everything. So if you get their attention for a second, and you better be good, accurate, it needs to work, and it needs to be able to be understood. And that's where customer education comes in, where you need to have ongoing cadences and a program there. But yeah, so while we may be spared the long cycles of sales cycles, value demonstration, integrations, that also comes with, I need value by tomorrow, or I may be looking elsewhere. And so those are the challenges.
Wow, fascinating. Okay. I've got breakout rooms assigned so that each room has either Jen, Lyndsey, or Shawn, and hopefully has a mix of folks who have experience in health tech and folks who are new to it. So I'm going to go ahead and open up the rooms, and we'll just be out there for 10 minutes, and then we'll be coming back for 5 minutes to share with each other and finish up. Okay, excellent. Thank you so much. It's been really interesting to me. So I hope you all enjoyed it. I did.
Yeah, we were having a good conversation. I just saw it was closing out, so I came over.
Yeah, and what kinds of highlights came up for you?
Well, it was mostly just it was interesting because I'm not in health tech. I've been in, more analog health, working with healthcare providers, with functional medicine protocols, medical foods. And so it was interesting to hear people talk about the health tech companies that they are working in and learning about them, and then what runs are needed for them. So a lot of people were talking about the regulatory issues and just how it impacted their actual jobs.
So you're sort of healthcare adjacent then?
Healthcare adjacent, but I'd like to move into health tech. Which is proving to be more challenging than I would have expected, but I'm still trying.
Right. And so what kind have you identified, like a specific area?
Yeah, I've been working with a startup with diagnostics, and I'm really enjoying that space. And I found other areas of health tech. The fact that I haven't worked with healthcare systems, I haven't worked with hospitals as clients, that's been an issue. So I think that diagnostics is both interesting to me and probably a better fit professionally.
Interesting.
Yeah, and goes along with, I've been in my whole career has been around preventative care, prescription alternatives to prescriptions and surgery. So diagnostics is definitely on the identifying issues, monitoring issues to have minimal interventions or just
All right.
more preventative oriented.
So diagnostics and preventative care being part of the health tech industry. What other kinds of areas of health tech came up? Because it is such a diverse industry.
Was one gal working for Point Click Care, which is very interesting, and how the analytics it provides on individual practitioners of not only number of readmissions, but also the cause of readmissions. And it's obviously saving money for the hospital or clinic, but also it's geared towards value-based care, which is an area that I'm very interested in.
Yeah. Linda Gordon, you're also, health tech, healthcare related, given, in terms of life loop, right? What area is that?
It is more for resident engagement, family engagement, senior living operations, not healthcare itself.
Mm-hmm.
I call it sort of fringe health tech. But it was interesting. We were having a conversation in the room at the very end about the staffing challenges right now. And so you're having to constantly keep retraining people and supporting people that way due to the staff turnover.
Right. And healthcare is such a hard field to work in, and with such low unemployment rates, it can be pretty tough to keep people around, I imagine. Yeah. Christina, you came off mute. Is there another area that you work in health tech?
No, I was the person she was referring to that worked at Point Click Care. So come off mute if there were any questions. But yeah, so I'm not familiar with LifeLoop. That's really neat. I'm really interested in learning more about your side. But I work on the acute and payer side of the Point Click Care business. So I'm familiar with the senior side of the house. But again, we own 85% of senior living facilities. We're kind of we're basically their EMR. And then we also work with hospitals, independent hospitals, ACOs, and clinics. And so again, it's about that readmission piece, but it's really fascinating. The turnover piece has been our biggest challenge, I think, especially with emergency room departments. Our chief medical officer has done a study on turnover rates, and it's about 2.5 years is kind of the average longevity in an ER, which is challenging, especially when our software does emergency room optimization and it does work with Epic. So I know there was somebody on here from Epic that was previous to Epic. But we integrate well with Epic and kind of tag on to their product and do a lot more. So we don't really work with the patients directly, but we work with operations and patient matching, and data has to be consistent and accurate. So that's really where our big challenge is.
Interesting. What other kinds of issues came up in your breakout sessions? We can just take another minute and flush some of that out. Anything? Aha moments? Lyndsey, you're off mute.
Hi. In our breakout session, one of the other great takeaways I thought to bring back to the whole group is just the importance of understanding the full healthcare industry. And if you work with health systems, for example, understanding even how payers work too, to truly understand your customers and clients, having that broad understanding of the whole cycle of the health system is really important because it's their daily challenges as well. So just thought that was an important takeaway for the group.
And when you say payers, what do you mean?
The insurance companies, and biggest insurance company in the United States is Medicare and Medicaid, and so that's the government. So there's a lot to learn there, and it's always changing, and it's part of the lingo and the challenge and the fun of this industry.
Great. Any other thoughts come up as you were in the breakout discussions? Any more questions come up that you want to be sure to get answered before we finish up here? Yeah, Nina.
So I'm not part of healthcare industry, but I'm very passionate about customer experience and success. And my curiosity was, and I'd ask this to Shawn, with this being such a regulated industry, how do you make customer experience better? Because you're so, watched over on how you get things done, make sure everything is right. But how can you make the experience better? What kind of innovation do you think you can bring into this?
From my perspective, definitely communication with the customer, but showing the value through being their technical advocate. I think showing them that you're looking out for their best interest and mitigating issues before they become an issue. I think that instills a lot of trust. But that is from our vantage point what has been successful with customer success. Once they see that you're advocating for them, you're the voice of the customer, they tend to trust you more, and it just becomes a lot easier.
It's the customer again. Lyndsey, you're off mute.
Oh, I think, even with regulations, there's so much room for creativity, and it's just, there are a lot of regulations, but it doesn't mean that there's not a lot of room for improvements and enhancements. So I think regulations aren't something that keep me up at night because they keep me from doing my job. It's maybe a extra challenge, but not something that keeps me from giving my customers what they need.
So it's just another thing to work around, but you're still essentially doing the same type of customer success, customer experience.
Yep.
Yeah. Jen, you came off mute. I wasn't sure if you were.
I would agree with that. No, I was just going to say I fully agree with that.
Yeah. Shawn, you had your thumbs up.
I agree. And just remembering most of us may actually be in B2B to C. So although you are supporting your customer, which is an enterprise or SMB or somewhere in between, they are supporting their patients and understanding what that experience may look like and how to always optimize for that will help you be in a good place with your customer.
Yeah, very much B2B to P or B2B to C, depending upon the area, the health tech area that you're in. Yep. So great. Any other closing thoughts that you want to share? Lyndsey, you're off mute, so I'm going to give you the option there.
Oh, okay. I mean, I just think this is such a great industry filled with so many passionate people because of that B2B to P, and so easy to find the value. We've all been a patient or know a patient who we just want to have the best care possible, and we get to be a part of that solution. And so that's why you find just the highest quality, most passionate people in this industry. And if you're not in health tech, I just encourage you to get engaged and involved if you're interested.
Oh, that's awesome. Great. Well, I went to the game late in terms of adding my LinkedIn. I hope that everyone else joined their LinkedIn. If not, you can all get back in touch with each other, continue the conversation over in the channel IND-Health Tech. So if you're looking to transition in, or if you just want to continue sharing best practices and challenges, things like that, that's why we started that channel. So I'd love for you to continue those conversations. And thank you again to everyone who put in the time to prepare for the fireside chat, and everyone here who came, especially this evening, to either share your own perspective and insights or ask questions. That's everyone brings something. It's all valuable, and that's what makes this community so fantastic. So thank you very much. Appreciate it. All right, next week we're going to be doing fintech, and fintech is just as varied. It's amazing. Think about it. Money isn't everything. So fintech should be a lot of fun. All right. We'll see you next week. Thank you.
Thank you so much for tuning into this week's episode of Success Hour, formerly known as CS Office Hours. We regularly put out new content, so to be the first to know, like this episode, tap that notification bell, hit that subscribe button, and we look forward to seeing you soon.